Well, thank you so much for having me here today. It's always a pleasure to be here at the Institute of Medicine. I'm actually starting to feel like I live here sometimes. But I think that's actually a strong testament to where we've come in the last few years as a company and as an entity that actually has put patients first every step of the way, that we've been seen as credible enough to be at these sorts of meetings, to talk to people like yourselves, who many of you in the room might be saying, what the heck is Patients Like Me? I'm not actually going to spend a lot of time telling you what Patients Like Me is in my talk today. I'm going to focus on a particular equation that I think will help us start thinking about the ways that patients and patients' perspectives can have the most significant impact on a sustainable learning health system. Without them, you will not have a continuously learning health system. So if we don't embrace that notion right off the start, we're probably not going to get very far. So let me start by first saying Patients Like Me has been around since 2004. We currently have over 250,000 patients on the site, representing about 2,000 conditions. We are very research-oriented and research-based, and when the question came up earlier about what do patients think about research, I sort of laughed a little bit and thought to myself, you know, patients actually don't think about it in the same way that all of you in this room think about it. They're not necessarily thinking, oh, I'm going to go participate in research. What they're thinking about is, I hope that the people who are taking care of me and are participating in different kinds of studies around the country are actually bringing to bear that information in my care. So when you ask a nationally representative group of people, 40% of whom had at least one chronic condition, how they felt about would they be willing to share their health data if that information would be used to improve their health or the health of someone else? 89% said yes, they would strongly agree or agree with that statement. Yet when we asked them if they thought that that was actually happening, most said they didn't know or no. So I think we have a long way to go to help patients and families in our communities to begin to understand that research actually is something that they should be engaging in, but we should also give them the opportunity to engage in it seamlessly. It should be occurring at the routine point of care. It shouldn't be this sort of thing where it sort of stands out as being, I'm now enrolled in a particular trial. It should be, I'm participating in a learning health system on a regular basis. And I thought Sarah's comment earlier was great. You know, patients aren't necessarily, they're sort of used to the idea that physicians and nurses have a practice, and we practice things to really get better at them. But the idea that we're sort of learning still is, I think, a little disturbing to most consumers. So I think what we need to start flipping that around to say, we're learning from you. We need to learn from you in order to do better the job that we know best. But we can't do it to the highest degree of excellence without you involved. So I'll start with that point and see where we go from there. I'm going to put up an equation, and I'm going to leave that on for most of my talk. I only have a couple of slides, but I really want to drive home a point. I created what's called this patient-centric value equation, and this was built upon something that we developed about 7 years ago now at Patients Like Me. It's the fundamental question that we try to help patients answer on a daily basis, and that is, given my status, so data, what's the best outcome I can hope to achieve, decision making, and how am I going to get there? So when I'm going to talk about this equation, I'm going to have it sit up here for a moment and just have you sort of take it in. On its face value, it seems pretty simplistic, and you're probably thinking, well, so sure, data plus some decision making is going to get me to an outcome of some sort. But what I want you to really think strongly about is to apply this particular equation at various levels. So we can think about this at the individual patient level, we can think about it at the caregiving family member level, we can think about it at the community level. We can even think about it at your institutional and system levels. But the fundamental thing about this equation is that shared data does not mean that you're sharing your clinical data with the patients in order for them to be able to make informed shared decisions and get to some outcome. No, what it needs to be is that we're sharing data that's mine as a patient with yours as a clinician, and then we come together to understand what are the benefits and burdens, what are the risks and the concerns that I might have that may impact my ability to be able to get the outcome that I want. So I really want you to fundamentally think about, what does shared data mean? Because that's where we're going to start. For the most part, most of you in your systems do not have a mechanism for systematically collecting patient-generated data. We all collect data about what patients say. We usually put it into quotes and we file it away in a chief complaint. But it doesn't necessarily help us learn very much about the next patient that might come along who maybe had that same subjective experience or that same chief complaint. So my charge here is to suggest that we can quantify patient-generated data in ways that we can aggregate it, collect it, learn from it, and then ultimately we've measured it in a way that we can then apply it broadly. So when you think about shared data, think about it from the perspective, again, of an individual person, a patient who may be willing and able to provide some information about their health experience in a way that you would never know unless you were to ask them in a systematic way to give you some input on that. Think about it from a caregiver's perspective. What are they doing? What are the MacGyver things they're doing at home in order to be able to keep their caregiving and their patients safe? You know, think about the kinds of things that people do at home on a regular basis. They're doing a lot more things just taking care of their daily needs and the observations of daily living that you have no idea about. And some of those are quite successful, and some of them are quite effective. So we need to find ways of being able to get that shared data notion really driven home, that it's not simply about biomarkers and clinical data and the things that we can measure in ways that an assay is going to tell us a number. We have to start thinking about it in ways of the experiences of patients and think about that from a systematic perspective. Now, think again. When I have the data that I want to share with you as a family member or as a patient, and you have the clinical data, imagine the power of those two coming together to fully appreciate what it means to make a good decision. You can't make a good decision unless you're sure you have a pretty good sense of what's the impact of this particular decision going to have on my life, on how I function. Will I be able to go to work? Will I be able to do the things, my role as a spouse or as a mother or as a caregiver of someone else? Will it impact those things? Those are things I'm going to have to weigh out and you're going to have to help me with. And I want to know that data based on who I am and what my status happens to be at this point in time. Now, the final one on this equation I think is the most important piece, and this is where I'm going to challenge you a lot. You know, I think we too often expect that patients can't quite rise to this occasion. Well, I'm going to challenge you that they definitely can. We see it every day on Patients Like Me. They're contributing immensely to our understanding of what it's like to live with illness and to live with multiple chronic illnesses. This isn't just one condition that someone has and we're putting it into the construct of, you know, okay, let's monitor this one condition over time. We're monitoring multiple conditions over a longitudinal period of time where patients can actually give us some insights into what that experience is like. So the shared accountability piece is really important because you know what? It's not just about the clinician getting a good outcome. It's about the patient getting a good outcome. And if we work on reaching that outcome together, we share the responsibility for where we got to. So if you were pushing as a clinician to do one thing and I was thinking, no, I'm not so sure I want to do that thing, and the ultimate outcome came out somewhere in between, I would at least be able to understand that we went through a process where I could weigh out what it was going to be meaning to me versus what the clinical expectation might be, and then be able to put that into the construct in the context of my life. Now, I think what Brett talked about before was the notion that, you know, an RCT, while certainly the gold standard, is incredible. The important piece not to miss here is just how important context is. And so I think it's time for us to really start to learn who our patients are, doing some really relatively new design techniques of persona-based design. Who are the patients that you're caring for? Do you really know them? Do you understand what the things are that they're up against at home? Do you know your communities well enough to be able to assure yourself that you could create some personas of the people that are coming into your system? So those are the kinds of questions we ask ourselves every day at Patients Like Me, and they're important ones I think that I want to drive home to you. I want to also just show you another thing that we spend a fair amount of time on. We looked at all of the outcomes that are currently in our system, and we start looking to see how are we doing on this? What's a clinical endpoint, a surrogate marker, and how do patients report symptoms and side effects, and how are we developing patient-reported outcomes, and is there really something such as a patient-centered outcome of N01? And then we worked across this grid to figure out, can we start gathering these? Do people care about them? If they do care about them, how can we then translate that into something that people at the other side of the care equation here are going to be able to use? So we spend a lot of time on this thinking about, from a patient's perspective, will any of these tools be useful, and how can we put them into practice, and how can we bring them into the clinical flow of care? So I want to leave you with a notion here. This is one of our very simplest tools that we have that every patient can use. It's called the Instant Me tool. And it's a question, how are you doing? A very simple question, but fundamental. And this is a bipolar patient. And you can see on the bottom, the hash marks there indicate how she was doing on any particular day, sometimes multiple times a day. And it ranged from very good to very bad and somewhere in between. But the important piece about this that I wanted to show you was that she brought this into her clinical encounter. And she wrote to us the other day, and she says, you know, I love what you did with the Instant Me graphs. It's really helping me be able to talk to my PDoc for psychiatrists. So here's what she says. I let my psychiatrist have a copy of my mood grid, and he was very impressed. Most of our patients tell us their doctors don't want their data. They bring in their doctor visit sheets, and the doctor says, I don't want to see it, because they're overwhelmed with data. So we have to find ways of bringing it to them in a way that's effective. He could see the pattern I spoke about 2 months ago. They had a visit 2 months ago, and she was saying, you know, I've got these patterns of my moods, and I'm really unsure how to go. We discussed the details up and down in the Y4s. I love that one. We discussed it, the three of us as a team, my doc, my love, referring to her family member, and me, my team. So I think if I'm going to leave you with one message, it's that patients want to see their data coming to life in a way that it's going to be useful to you. And you as systems can start to come and reach into a group like us and say, listen, can you help us better understand what patients' experiences are? We're having trouble figuring out how to sustain this. And I think that if you begin to embrace that notion, you will find that patients are ready, willing, and able to participate in a variety of questions and researches, studies that you might have in mind, and that actually could bring insights that you'll just never get in any other, certainly not in this room for the most part, except with a few people that are in the room, but you will not get that rich contextual experience that you need to have in order to be able to know this can be sustained, and we can take health, which is local, and make it global. And I think that's what we really need to be reaching for, is that sense of your experience, like so many other people's experiences, when brought together, can inform the learning health system. So thank you so much for your time. I really appreciate it, and I'm looking forward to the discussion.